Mental health complications are very common in arthritis.
There's a lot of stress that goes with living with a chronic disease, living with pain every day.
Addressing the mental health aspect is as important as addressing the physical aspect. And, there's a interaction between both of them, and we can't address one without the other.
I'm Susan Bartlett. I'm an Arthritis Research Canada scientist located at McGill University.
I'm Deborah Costa, and I'm a research scientist affiliated with Arthritis Research Canada. I'm based at the McGill University Health Centre in Montreal.
I'm Vera, and I'm a research scientist at Arthritis Research Canada. For my research, I'm going to be using big data in British Columbia, so information on people's healthcare visits, hospitalizations, and medications, so that I can better understand how anxiety and depression relate to arthritis. For example, when people are being diagnosed with rheumatoid arthritis, how much depression is already present at the time of diagnosis. And after people have been diagnosed with arthritis, what is the risk of developing depression and anxiety? When is that risk highest? Is it in the year after they've been diagnosed? Is it 5 years down the road? What are some of the risk factors? Are females more likely to be diagnosed with anxiety or depression? Because when we understand these risk factors, we know what healthcare providers, what doctors, what family members can help try to address.
I'm involved with a national early arthritis cohort that's known as CATCH. And CATCH happens to be the largest cohort of people who are entered around the time that they're diagnosed with rheumatoid arthritis. So we had the advantage of being able to look at about 2,000 people. And out of the people coming into our cohort, 52% reported that they had had one of these major stressors in the year prior to diagnosis. Despite this, we found on average the people who reported that they'd had a major stressor had much worse symptoms, even for the same level of arthritis. So their pain was worse, their fatigue was worse. They had more difficulty doing the things that they needed to do.
An important part of my research right now is addressing the accessibility issue to mental health and to self-management resources. So right now I'm involved in developing, refining, and evaluating internet-based interventions to promote self-management, mental health, and in particular, sleep difficulties. Up to 60 to 80% of patients living with arthritis will experience sleep difficulties at some point.
It's actually a cyclical relationship between these two conditions that we need to disentangle. It's incredible to think that up to 70% of patients with rheumatoid arthritis report having anxiety. Up to 30% of patients with lupus report having depression. Even up to 10% of patients with gout have anxiety. And these are just the numbers that are being measured. Because of the stigma of mental health, there may be more patients that are suffering from these complications.
A lot of times when patients experience these symptoms, they tend to minimize the importance of these symptoms, and they may be reluctant to talk to their healthcare provider about these symptoms. We're not there yet in terms of awareness and in terms of identifying it and managing it effectively.
Stress management is important. I'm talking specifically right now about people with rheumatoid or inflammatory arthritis. But I think this applies every bit as much to people with osteoarthritis. I think if there is one good thing that is definitely going to come out of this pandemic experience, it is the normalization of the struggle of mental health and how we're all very vulnerable to what's happening around us.
So I'm going to be studying, what care people with arthritis who suffer from depression and anxiety are getting. Are they using medications? Are they seeing psychiatrists? Are they seeing counselors? Again, I want to understand if they're getting appropriate care so that they can be well supported.
So patient involvement in research is critical at all stages of the research study.
Why did we pursue this line of research? It was because people like you told us it was important. Keep pointing us in the right direction to find the things that really make a difference and to help us better help you to live your best life with arthritis.